This video is brought to you by Saraswati Vidyalaya Union, and this is Prapti. Today we are going to study about the chapter 8, Respiration and Circulation. From this we are going to study about the blood pressure. Now let's see.
So the next concept is there, that is about the blood pressure. Definition is very easy. Now let's see the definition. The pressure exerted by blood. The pressure which is exerted by blood on the wall of artery. On the wall of artery, it is known as the blood pressure. See this definition, it is very easy. Always see that. Always this blood pressure is identifying on arteries only. Okay. Now here, how this blood pressure is measured? So this blood pressure, it is measured by maybe all of you knows it, because if you are not feeling well, if you are giving visit to doctor, so that time doctors are using the particular instrument for identifying that blood pressure. See that it is measured by particular instrument, and that instrument which is known as the sphygmomanometer. This is the instrument. Okay, with the help of that instrument it is measured. Afterward, in one of the lecture I'll show you the sphygmomanometer, and in that lecture I'll explain you how to measure that blood pressure. Okay, in this, as I have already explained you, this blood pressure is always measured in the arteries only. Now here, this artery, here types of blood pressure. See that in one of the lecture I have already explained you about the systole and the diastole. Systole means what? That is contraction of muscle, and diastole means what? That is a relaxation of the muscles. Now here we are going to study about the two types of this blood pressure. One of the type of blood pressure, it is known as the systolic blood pressure. Okay, one of the type which is known as the systolic blood pressure, and the second type is there which is known as the diastolic blood pressure. Diastolic blood pressure. These are the two different types. One is known as the systolic blood pressure, second one diastolic blood pressure. If you understand this definition, so this definition will be easy for you all. How these are easy? See that the same definition here. The pressure exerted by blood. The pressure exerted by blood on the wall of artery. On the wall of artery. But here the important word is there. On the wall of artery during ventricular now systolic is there. Systole means what will be here? Ventricular contraction. Ventricular contraction. Okay, the pressure exerted by the blood on the wall of artery during ventricular contraction. That means it is known as the systole. Ventricular systole. That is only known as the systolic blood pressure. And remember this one, this systolic blood pressure, it is always how much? That is always, it is 120 mmHg. 120 mmHg. about the systolic blood pressure. Okay, now let's see about the diastolic blood pressure. The same thing is there. Now hope you all got this idea, systolic blood pressure and the diastolic blood pressure. Now here the pressure, shall I write down here? Okay, second type, I'll write it down here only. Now the second type is there, that is known as the diastolic blood pressure. So you all are getting these points, diastolic blood pressure. While teaching only you can write down these notes. Now the same definition is here. The pressure exerted, same thing, the pressure exerted by blood on the wall of artery. See that here also artery, here also artery, here also artery, here also artery, because this blood pressure is measured in arteries only, on the wall of artery during. Now here the important thing is there. Here diastolic is given, so that's why during ventricular diastole. During ventricular diastole, it is known as the, or you can say that, ventricular relaxation. First I'll write it down, ventricular relaxation, or it is known as the diastole, and that is known as the diastolic blood pressure. Okay, now here this diastolic blood pressure is always 80 mmHg. Okay, and always how the doctors are measuring this blood pressure, that is systolic and diastolic, and like this they are telling us. This generally, so how will be, it is 120 80 mmHg. Like this there is a measurement of this blood pressure. Okay, but during this measurement there is a difference between the systolic and the diastolic pressure. The difference between the systolic and the diastolic pressure, it is always known as the pulse pressure. Okay, and on the basis of this pulse pressure only we can identify, I mean doctors are identifying the different diseases. See that, I'll write it down here. Difference between systolic and diastolic blood pressure, that is known as the pulse pressure. Means how much it will be. Now here systolic blood pressure is how much? Systolic blood pressure. Okay, I have used the short form, but then also systolic blood pressure minus diastolic blood pressure. Okay, systolic is how much? 120 mmHg, and diastolic is how much? That is 80 mmHg. Means how much it is? So that diastolic blood pressure is always 40. Yes, 40 mmHg. Normal, that pulse pressure is always 40 mmHg. If suppose this pulse pressure decreases or increases, so that means that person having few disorders. Okay, so on the basis of this blood pressure, doctors are identifying many disorders. For example, the disorders, first write it down this. Okay, then I'll see this. Now I'll tell you about the disorders. For example, the few disorders only I'll explain you here, and then after this I'll explain you about the factors affecting blood pressure. Now here the first disorder is there. Okay, also you understood this. Okay, blood pressure, types of blood pressure, systolic blood pressure, diastolic blood pressure, and the pulse pressure. That is 40 mmHg. Okay. are the few disorders such as there is a deviation from normal blood pressure value indicates malfunctioning of this heart, and it may be due to the high or low blood pressure, such as here if suppose there are any changes into the artery. Okay, so for example there is the arterial inelasticity. Means all of you knows that where it is elastic in structure, that tunica media is there. So there is arterial inelasticity. And if suppose there is a hardening of this artery, so that disorder, that heart related disorder, see, hardening of artery, what I am saying, arterial inelasticity and hardening of the arteries. If that arteries are not contracting properly, if suppose that middle, that tunica media becomes hardened, so it causes one of the disorder, and that disorder which is known as the arteriosclerosis. Remember this concept, it is known as the arteriosclerosis. Okay, and whenever there is deposition of fats into the artery, there is deposition of fats like cholesterol. अगर तुम लोगों को बाहर का खाना खाने की ज्यादा आदत रहेगी, घर का खाना पसंद नहीं है, अगर बहुत ऑयली खाते रहेगी तुम लोग, so this deposition of artery, deposition of fats like cholesterol, the cholesterol level increases. Okay, deposition of fats like cholesterol into artery, that into the lumen. Means how here, suppose these are the arteries. Okay, and inside that arteries, if suppose there is a deposition of the fatty substances, so here first slowly suppose inside the lumen there is a deposition of fatty substance. Okay, then after what happen, if you are not stop your food like this fatty substances, so then what happen, so these fats get deposited here, it forms a plaque inside that arteries, and then what happen, it creates, I am talking about the internal structure of lumen, we have already seen that outermost tunica externa, this is the tunica externa. Okay, then inside the tunica externa there is a tunica media, and this is the tunica interna, and this is the lumen. Inside this lumen I have shown this is the deposition of fats, so there is no proper blood flowing through that heart, through that arteries, and arteries are always providing blood towards the body part. Okay, then body part is getting less blood, so here this concept, deposition of fats into the lumen of artery. You can say that into lumen of artery. So this concept which is known as the atherosclerosis. Remember these two definitions. It is very important for the filling the blank. So hardening of this middle layer. Whenever this artery becomes inelastic and hardening of this layer, so that is called as the arteriosclerosis. And whenever deposition of this fat, that fatty substance like a cholesterol into the artery, so that is known as the atherosclerosis. Okay, as well as there are the other disorders also there, so such as the renal diseases also there. These renal diseases and emotion induced hormonal changes, obesity, it is also responsible for the heart attack. These are the reasons behind the heart attack. These are the reasons for the heart related disorder or the blood pressure related disorder. So we can say that blood pressure related disorder. Whenever that person is more obese, so in that person there is a high chances of this blood pressure. That person having the blood pressure. If suppose that person having the renal disease means what? Kidney problem. So then the blood pressure is increases into them. If suppose that diet is not proper, okay, and there is suppose whenever there is any emotion related hormonal changes are there. Okay, emotion related hormonal changes. It is responsible to increase the blood pressure or decrease the blood pressure, then it is responsible for the heart attack. For example, अगर कुछ अच्छी न्यूज़ मिली, अचानक से अच्छी न्यूज़ मिली, फिर भी अटैक आता है. कभी बुरी न्यूज़ अचानक से मिली, फिर भी हार्ट अटैक आता है. So because there are changes takes place into the hormones, suddenly the changes takes place into the hormone, and it causes that increase in blood pressure. Okay, so this are the reasons for these blood related disorders. Now here the one more thing I will explain you कि whenever this blood pressure, normal blood pressure, how much I told you, 120/80 mmHg. This is what? This is the normal blood pressure. Okay, this is normal blood pressure. But whenever this blood pressure increases more than this, means whenever that blood pressure becomes 140/90 mmHg, whenever that blood pressure becomes 140/90 mmHg, so that time it is known as the hypertension. The reasons behind the hypertension are different. That reason we'll see in the next topic. Okay, whenever that blood pressure is more than the normal, that means approximately 140/90, and whenever the blood pressure is less than this 120, means how much? It is 90/60 mmHg. It is known as the hypotension. Okay, so these all are related to the disorders. Okay, arteriosclerosis, atherosclerosis, reason behind this is what? Obesity, renal diseases, emotion related hormonal changes, and here I have explained you about the hypertension and the hypotension. Okay, now in the next topic we'll see that the factors responsible for the heart related disorder or the blood pressure related disorder.